We now will go to Mr. Swaski for 5 minutes. Please go ahead.
Thank you, Chair. Thank you to the witnesses. First question is for TELUS Health. Could you walk the committee through how Prescribeit was originally developed, particularly how key partners were brought in and how decisions were made about the platform structure and delivery?
Mr. Al Demirdash.
Thank you for the question, Mr. Chair. In 2017, when the RFP was awarded to us, we began to the implementation per the design that was put forth to us by Canada Health Infoway as part of the RFP process. We either had our own technology that we brought to the table, this 85% approximately of the IP that has been mentioned earlier, along with us developing the remainder per the specification that we had. We did not have any subcontracted work as per se. We did have some fixed term contractors that joined our team in the period between 2017 and 2020 that brought in some technical expertise, but they were essentially acting as team members within our organization to help in the software development of that 15% IP.
Remember,
85% determined. How was that number landed on?
Mr. Al Demirdash.
There's no precise way. I mean, it's a approximation based on the full solution and looking at the components of it. In reality, when we consider the specific components that are in the IP that is owned by Canada Health Infoway, that's based on the specific implementations that were requested of us. And the 85 and 15 is essentially just an approximation. It's no mathematical equation.
Honorable Member.
To what extent were there issues with the application itself, whether in terms of functionality, usability, reliability, or integration into clinical workflows that might have affected the adoption of this technology?
Mr. Al Demirdash.
Thank you for the question, Mr. Chair. The technology itself functioned precisely to the specifications that we were given and was at a 99.9% uptime. In fact, we were held accountable to reach that. And in some cases, we actually gave some credits back to Canada Health Infoway when, for one reason or another, it fell below 9%. However, as I'd mentioned earlier, we did convene a clinical advisory board that did help identify for us, based on their perspective, that the design specifications for the user interface were not necessarily done in a way that was along with the natural workflow of the prescribers. So it made it a bit more difficult for them to complete the prescription activity and as well on the onboarding process. And those were recommendations that we provided to Canada Health Infoway in April of 2021 in an attempt to help provide some of that feedback.
Member.
Thank you. And if providers and provinces were not satisfied with the product, what efforts did TELUS take to modernize or adapt the program to make it more attractive?
Mr. Al Demirdash.
Thank you for the question. It is important to recognize that we were developing the solution per the contract that we had in place with Canada Health Infoway and governed by developing and delivering on the specifications that we were given by Canada Health Infoway. What we did along the way is meet those specifications exactly to the letter of that we were given. We did provide some ideas and recommendations, but that was up to Canada Health Infoway to come back to us and request those changes to be put in place.
Member.
How often did TELUS update, modify, and modernize the product? And did it take steps to solicit customer feedback to inform improvements?
Demirdash.
The Clinical Advisory Board, thank you for the question, Mr. Chair. The Clinical Advisory Board was one of those ways where we got feedback and provided feedback to Canada Health Infoway. Another prominent way that we did that was to put together this e-prescription white paper that was released last year that provides overall recommendations, including the importance of having mandates and standards in place to drive adoption for e-prescription. As far as the initial part of the question on how often we made changes to the product, those were all governed by the process through the change orders that we would have received. We received 59 change orders through the life of the program, and we implemented all of those.
Minutes, 11 seconds. Okay, before we go to the next member, I would love to welcome Member of Parliament Fancy to the committee. And with that, we will go to Mr. Blanchett Jonka for 2.5 minutes. Please go ahead.
Est-ce que vous pouvez confirmer que TELUS...
Dr. Wan, can you confirm that TELUS owns about 85% of the intellectual property that has to do with the Prescribeit platform?
Thank you for the question, Mr. Chair. I think that is a correct estimate, given that they have the ability to, in their hub, to integrate a variety of products.
Qui concrètement a négocié cette entente?
Who negotiated those terms?
I stop the watch.
Ask my colleague.
Okay, Miss Ansar, go ahead, please.
Thank you, sir. The negotiation for TELUS was a fairly deep process. We actually had an RFP process that led to the selection of TELUS.
La question, c'est qui a négocié cette entente?
The question is, who negotiated this agreement?
TELUS Infoway negotiated with TELUS with the aid of a professional negotiator.
Remember,
Dr. Vaughan.
So, Dr. Wan, 85% of an IT program that is owned by a private company, and we're talking about $300 million of taxpayers' money. Is that a success or failure?
Thank you for the question. That 85% is a technical part that of the hub that TELUS has. The 15% of that part that is really what involves the opportunity to have an open standard approach that allows for the provinces and territories to use that. They can use that too.
Monsieur Eldemerdash.
Mr. Eldemerdash, how much money, taxpayers' money, did you receive from the government?
Mr. Eldemerdash.
Thank you for the question. TELUS Health received approximately an average of a little bit over $10 million per year over the 9 years of this program from Canada Health Infoway.
Remember.
Total?
So in total?
Eldemerdash.
In total, it was, to be precise, it was $98 million.
Est-ce qu'il est payé le programme enfin avec tout cet argent-là?
Mr. Chair,
The question was inaudible.
Mr. Blanchett Jonka, if one person speaks at a time, it will be easy for the interpreters because there's no interpretation. So I stop the watch. I give you the time, even though you have only 7 seconds left. But I'll give you a question.
Avec l'ensemble de l'argent des fonds publics que vous
So
avez...
with all the public money you received, is the program paid up? Is it paid for with all this money that has been received?
Dash.
Thank you for the question, Mr. Chair. The funding and the compensation that we received was for us meeting the specifications and the requirements of the contract that we had in place with Canada Health Infoway. And TELUS Health was successful in implementing all of the requirements that we received.
Monsieur le Président,
c'est
oui ou non, est-tu payé ou pas le programme?
Mr. Chair, it was a yes or no question.
Question,
Mr. Chair, they're not answering the question.
That
un
is,
cirque, là, ou quoi? Là?
You can make arguments, but I'm going to go to the next one.
Non, Monsieur le Président, quand même. Là.
Okay, we'll go to Madam Konaz for 5 minutes. Please go ahead.
Mr. Kalra, does Canada Health Infoway Executive Vice President Abby Kalra hold any shares or stock options in Loblaw Companies Limited since he was hired by Infoway? Yes or no?
Mr. Wong.
Oh, thank you, Mr. Chair. I wasn't sure who the question was directed to. Not that I'm aware of. I don't know.
Member,
That would be part of the process of screening who you would hire as executive vice president, correct?
Dr. Vaughn.
Not aware that question's ever been asked of any employee that was hired.
Okay,
Member.
so that would be extremely important because that person would benefit from these contracts. So if you could please find out that information and table it for this.
Dr.
Mr. Chair would be happy to have the HR people respond to that.
Thank you.
Honorable Member.
My question, Dr. Vaughn, what year was CFO hired on an interim basis?
Dr. Vaughn.
Chair, I believe it was 2023.
Member.
And we do know that he did work with Michael Green. Did Michael Green recommend him for the position, the interim position of CFO?
Dr. Vaughn.
Mr. Chair, I believe so.
Now, does the current CFO continue to be interim?
Dr. Vaughn.
That is my understanding, yes.
Honorable
He is
Member.
interim, and he's been interim since 2024. That seems unusual that someone would be interim for more than 2 years, especially the number of employees you have. I'm sure you have HR people. Why would you have not gone out on for a competitive process for that position?
Dr. Vaughn.
Mr. Chair, the organization is, as I said, indicated earlier in relation to the chief financial officer or the chief executive officer. We're going through a period of transition to try and understand what skills we're going to be needing going forward. So once we have a new CEO in place, then we will be.
So Michael Green was not able. The new CEO will be able to decide or help decide who the CFO should be or how the competitive process should go. But the old Michael Green was not able to do that on $900,000 salary.
Dr. Vaughn.
Mr. Chair, we are in the process of looking at what kind of transitions we need to make in our new mandate, and it's going to be obviously different than what we had in the past. And so that would be a part of the job of the new CEO.
Honorable Member.
Could you tell me if the CFO, the current CFO, owns any individual shares in public companies?
Dr. Vaughn.
Mr. Chair, I do not know the answer to that question.
I think it would be important for you to table that information and for the public to know before he becomes a permanent CFO, and since he's been there for 2 years. Can you tell me what his salary is,
Dr.
including
Vaughn.
bonuses?
Sure, I think that's been publicly communicated in the documents.
I'd like
that
to
we've
hear
sent
it here for the Canadian people.
Mr. Chair, I don't have that information before me, but it's been shared with the committee, and it's been publicly stated in the media.
The CFO's salary
I believe so.
has been publicly stated in the media. Okay, would you please table that immediately?
We will absolutely do that, Mr. Chair.
Thank you. Thank you. So I have a question for Mr. I'm sorry if I say your name wrong, Eldemir-Dash. Thank you. Did you raise any concerns about any possible obstacles or challenges that Prescribeit could face to Canada Health Infoway, the Department of Health, or the Minister of Health's office? And if so, what I think you might have mentioned earlier, you had 56 or 57 recommendations. Is that true? You did bring forward 57 concerns or 56 concerns?
Mr. Eldemir-Dash.
Thank you for the question, Mr. Chair. Let me make sure that the numbers that I stated are clear in what they are. The 59 change orders were change requests that we received from Canada Health Infoway to make changes to the initial requirements or specifications that were provided to us, and we implemented those changes. As per the first question that was asked, or the first part of the question around did we raise concerns, in April of 2021, we did provide a document to Canada Health Infoway with an output from the clinical advisory board that we put together.
Excuse me.
10 seconds.
What did they do with that and with that information?
Mr. Eldemir-Dash.
Chair, I don't have the answer to that question. We provided it to them with a recommendation.
Do you know if they made any changes? Yes or no?
It would come through some of the change orders, but not all of the requests that or the recommendations, I should say, would have come back to us.
Thank you very much. Now we will go to Dr. L. Ols. Here we go. This is clear. Okay,
Thank you, Chair.
Dr. Olson, please go ahead.
I'd like to thank all the witnesses for coming. Now, I just want to make sure I understand to Dr. Vaughn regarding this system. The purpose of this system was one prescribing system that was compatible all across provinces because it was the same system. Had there been an expressed need for this? Had there been direction from government or from other agencies saying that was it generally acknowledged that this is what we needed so that in Canada people could have prescriptions that talk to each other across the provinces? Is that correct?
Vaughn.
Thank you very much, Mr. Chair, for the question. It's an excellent question. Canada being the only OECD country that doesn't have a national prescribing service, at that time it was recognized that, as you are well aware, I'm sure, that patient safety, medication error is one of the top reasons for patient problems, and so it was recognized it was time that Canada adopted a national prescribing service.
Remember,
So the lack of uptake from prescribers is attributed to the fact that, as per experience in other countries, which gave incentives and mandates, that the provinces did not do this. At what point were the provinces told that this is something that they should do to increase uptake of provinces and territories?
The provinces, in many discussions with provinces and territories, at deputies' tables, at ministers' tables, and many other senior representative tables, the conversation around mandates and incentives was initiated. But we do not control the priorities of the provinces and territories.
remember,
Thank you. And had the provinces and territories given any reasons or rationale for not adopting these?
Dr. Vaughn.
Mr. Chair, through you, the provinces and territories, I think, are always reluctant to adopt federally initiated ideas, concerned about long-term sustainability, perhaps, but I'd be speculating.
Honorable member.
All right. Thank you. Now, if the provinces and territories had agreed to do this, would it be fair to say that this program would be a success if the provinces had done what all these other nations had done that had directed that?
Dr. Vaughn.
Mr. Chair, through you, absolutely, that is the answer.
Honorable member.
Now, there's been advocacy for just simply give each province the money to do it, and they can develop, quote, their own system. What is the likelihood that 10 provinces and 3 territories independently funding their own programs, that this would be compatible across all provinces? Does that sound likely that you'd have a compatible system between all the provinces and territories?
Dr. Vaughn.
It is possible, Mr. Chair. It is also like, having no air traffic control across the country and every province and territory deciding what the air traffic control regulations and rules would be. If you were flying from Halifax to Ottawa, you'd have to land in every province and territory. It's possible, but it is unlikely. The opportunity going forward is to use all the value that we have gained and to initiate the open standards, which still allows the exchange in a new way going forward.
Member.
Now, I guess this is, I don't know who would be the best to answer this, whether it be Dr. Vaughn or Dr. Eldemirash. Everyone talks about, all the money that's gone into this program and saying that this money's been wasted. But I understand that the product is still there and will still work if implemented. So if any provinces or all provinces decided to start using this, would this work and be a success? Dr. Vaughn first.
Dr. Vaughn.
Thank you for the question, Mr. Chair. That is the case. That it has been built. The highway analogy has been built, and if provinces and territories wish to populate that highway, absolutely, it can be used. And that's the benefit of the open standards, frankly, going forward, is that they can customize their solutions to meet their particular needs and their workflow needs of their physicians and providers.
Thank you very much, 505. And we will go to Dr. Strauss for 5 minutes. Please go ahead, Dr. Strauss.
Thank you, Chair. Through you, Dr. Vaughn. Some of the documents I've seen suggest that Canada Health Infoway has paid $2.5 million over 3 years to government relation firms, namely Sussex Strategy and Crestview Strategy. So Canada Health Infoway, as a creature of government appointees, then gave $2.5 million to get independent contractors to lobby governments. Do I have that correct?
Dr. Wong.
Mr. Chair, we did not lobby government, and there was no money spent for lobbying. Infoway does not lobby government.
He's lobbying with the $2.5 million.
Mr. Chair, if I could add that communications firm has helped Infoway in its consultations with stakeholder groups across the country.
How much money does Canada Health Infoway expect to receive from the federal government with respect to the implementation of this open standards initiative as outlined in Bill S5?
Dr. Wong.
Mr. Chair, that is still up to the federal government, and I do not have a figure for you.
What is the board per diem rate?
Mr. Chair, the board per diem rate is around $700, I believe.
Okay.
Remember,
Dr. Vaughn, could you provide to the committee a detailed breakdown of all of Canada Health Infoway's tendered contracts since 2016, including a description of the services rendered?
Dr. Wong.
Mr. Chair would be happy to do that.
Honorable member.
You keep using this analogy of a highway. The highway's built. The highway costs $300 million, but there's no traffic on the highway. For you personally as a taxpayer, if your province spent $300 million on a highway that nobody wants to use, maybe because of where it goes, would you call that a successful use of $300 million?
Mr. Chair, the analogy can be overextended, but it is an enablement over 10 years, that $300 million. So that money's been spent over 10 years.
Serves well with this extension. Because what I keep hearing you say, and you seem like a nice person, but it's offensive to me, the idea that doctors won't use this wonderful tool that we built unless we mandate or incentivize them, like force them or bribe them. Like, I'm a doctor, you're a doctor. We like to use technology to help our patients. If you make something and they don't want to use it, could it be because the thing is bad?
Dr. Wong.
Mr. Chair, I would refer to the international experience. All the OECD countries in Australia and New Zealand have gone through exactly this same juncture, the adoption requirement of mandating or incentives, and it's the same thing with EMRs, electronic medical records.
So they had $400 million or thereabouts, and they used it for incentives. And we gave our $400 million to Canada Health Infoway, and now they have 95% of their prescribers using e-prescription, and we have less than 5%. So, maybe the difference is we have Canada Health Infoway, and they don't, and that's why we haven't succeeded.
Thank you for the question, Mr. Chair. All of those countries have a digital health agency, and all of them spent a comparatively similar amount of money at this juncture.
Honorable member.
But they succeeded. Mr. Eldemirdash, quick question. Is TELUS Health providing this sort of service in any other countries?
Mr. Eldemirdash.
No. Thank you. Back to Dr. Vaughn. Were there any recusals for conflict of interest at board meetings during your tenure?
Dr. Wong.
Thank you, Mr. Chair. I have to think about that. During
Would
my
you please
tenure.
table it with the committee?
One person at a time. I stopped the watch. I will let Dr. Wong finish.
I don't believe so, Mr. Chair. No, that's not true. I think there was one conversation from one member from Ontario, who did recuse herself.
Dr. Strauss, please go ahead.
If somebody recuses themselves for a conflict of interest, and in that episode, do they stay in the room for the discussion and merely not vote, or do they leave the room?
Dr. Wong.
As I recall, the individual left the room.
Okay. One more question for Mr. Eldemirdash. If if TELUS Health were to offer this service in another jurisdiction, how much would they charge?
Mr. Al-Damadash.
Thank you for the question. That would depend on the requirements that would be set forth to us by the province or the jurisdiction, and their requirements and what the program would entail.
Honorable member.
According to Canada Health Infoway documents, $167 million was spent on operation and overhead costs for Prescribeit, of which $108 million was for personnel costs. Why did an outsourced technical platform require $108 million in personnel costs?
You have 10 seconds to respond.
I'll ask my colleague.
Okay, please go ahead.
Thank you, sir. The money that we allocated to program operations included oversight for the work that we did, risk management, insurance, legal costs, engagement, marketing for awareness.
Quick point of order, Chair.
Your time is up.
Yeah, but it's a point of order.
Point of order you can take.
Could the clerk confirm with you that she's kept track of everything they've offered to table, and that these things will be tabled within 2 weeks?
It is in the notes. It will be a part of the.
Thank you, Chair.
The prescription. Okay, so thank you, Dr. Strauss. Very well done. I appreciate your cooperation in this way. So now we will.
Point of order. Chair, just clarification. So we are running till what time?
5:50.
5:50, like 10 to 6.
5:50, yes.
10 to 6. Okay.
Yes.
Thank you.
Okay. You okay with that?
Yeah.
Okay.
Yeah.
Thank you. Okay. Now we will go to Dr. Zazik for 5 minutes. Please
Thank
go
you,
ahead.
Chair.
Thank you.
And thank you to the witnesses. There have been a lot of important questions asked, and obviously your responses are duly noted. Dr. Vaughan, you made it very clear that you feel every other jurisdiction that has put in place a Prescribeit-like program, that they have provided incentives to physicians to use the program, and also in some cases mandated through legislation that this program be adopted. When did you make this clear that this was your strong opinion actually through the process since you became chair of the board?
Dr. Vaughan?
Thank you, Mr. Chair, for the question. It was clear early on that we were going to need mandating or legislation, and had talked to all of the provinces and territories around that. All the provinces and territories are at different places in this journey, and they have different priorities, and governments change. And when governments change, priorities change. And so it's an ongoing education of trying to educate new people coming in around what we are doing and what we're trying to do, and the need to look at incentives and legislation. You know, in my own province of Nova Scotia, we brought in legislation to connect electronic medical records across the province. The opportunity for us going forward in Nova Scotia is very much as a part of the open standards approach, because it fits in perfectly with the Nova Scotia needs.
Suggesting that with the open standards going forward, that there will be a need. Is it either or incentives or mandates?
That's a good question, Mr. Chair. My sense is from the international literature is very strong that mandating or incentives are what it takes to achieve adoption, just like we saw with electronic medical records 20 years ago.
In your consultations, you've mentioned deputy ministers, but to what extent did you involve in your promotion of the program? Because you knew you didn't have incentives, financial incentives, you didn't have mandates. So presumably you consulted broadly with medical associations, because deputy ministers could possibly be a little isolated from the field. So can you explain what kind of promotional activities you engaged in specifically to try and get more prescribers involved?
Thanks for the question, Mr. Chair. I'll ask my colleague, if you will, to answer the details.
Ansar, go ahead.
Thank you for the question. We undertook significant marketing awareness and stakeholder relations campaigns, including that with provinces and territories. We met with them at both a senior level at the deputy minister level, including as well as with staff level at the digital health group to work with them. The work with them was ongoing. In addition to that, we did a significant work with physicians, with pharmacists. We actually ran special programs where we had pharmacies in a community.
Excuse me, but you did have success with pharmacies, but I'm interested in the prescribers piece.
Right. Yes, what I was saying was that we used pharmacies in communities to reach out to their prescribers to try to bring them on board to help build adoption for the system. So the work that we did was multifaceted.
El Demerdash, you talked about your clinical advisory board. When did you establish that?
Mr. El Demerdash.
We use clinical advisory boards frequently for many of the products that we have to solicit feedback on them and to learn what are the needs that are out there. In this specific scenario, the clinical advisory board was in the early part of 2021.
Did you hear about incentives, or I'm not mandated to do it? Did you get any kind of feedback along that line, or was it purely technical related to the software?
Primary point of feedback that we received from the advisory board was around their wanting the process and the system to be a lot less frictionless for them in the way that they do their work, and that it was not, in some cases, taking into consideration their normal workflow and the normal way that they do their work.
Good. Dr. Zazik, time is up, 5:05. And we will go to now Mr. Blanchett Jonka for 2.5 minutes. Mr. Blanchett Jonka, one person at a time because of the interpretation. I'm not going to be in between you both, so please pay
Monsieur
attention.
le Président, vous le savez que mon temps est très limité. Hein,
Mr. Chair, you know that my time is very limited because, and if I cannot get an answer to my question, it's also your role to make sure that the witnesses are answering the questions. But they're not.
To them to say, I can't dictate what answer they should give. All I can say is I give them the time. It's up to them because it's up to you to ask a question again or make those comments. But anyways, let's start now with 2.5 minutes.
Besoin de votre aide là-dessus.
Okay.
I need your help because, yes, I'm asking the questions, but not getting answers.
Monsieur Demerdash, TELUS a reçu environ 80...
Mr. El Demerdash, so TELUS received about $98 million of public money for Prescribeit. What was TELUS's initial estimation with regard to how much it would cost to develop the platform?
Thank you for the question, Mr. Chair. I don't know the answer to that question, as that was back in 2016, prior to me being part of TELUS Health. However, we can find the answer to that question and provide that to the committee.
Merci, Monsieur Demerdash.
Thank you. So you're confirming that TELUS owns 85% of intellectual property. Is that the case?
Sorry, if you can ask the question again, it was not clear.
Honorable member, please go ahead.
Monsieur le Président, là, c'est pas juste de...
Mr. Chair, it's not just sufficient to stop because when this happens, I'm losing time. I need to get the time back.
The time?
Je dois répéter la même question.
But I will have to repeat the same question, so I'm losing time.
I'm stopping. The watch is stopped.
Oui.
Okay, so you are not losing the time. You still get your full time.
Alors, vous me redonnez le temps que j'ai posé.
So you're giving me back the time it took for me to ask the last question.
Seconde, Monsieur le Président.
How many seconds, Mr. Chair?
1 minute and 48 seconds.
Alors, si je perds pas de temps, combien...
Okay, if I don't lose time, how much time are you giving me back for repeating the same question I asked?
Here, I have made it very clear. I'm sure it's clear to the honorable members. When I stop the watch, it means your time, whatever you're saying, I'm not taking your time away from 2.5 minutes. I hope it's clear to you now. Understand? Or
Pas vraiment très clair.
Not very clear. Mr. El Demirdash, my question is, can the government use, modify, or transfer the Prescribeit technology without TELUS?
Mr. Demirdash.
Thank you for the question. The government and any other technical implementer can take the standards and certainly implement the same technology to whatever standards that there is. We've obviously spent a lot of time and funding of our own side as well in developing the technology that is being used in this solution.
Le gouvernement a seulement 15% de la propriété.
The government owns only 15% of intellectual property. Can they still make it work without TELUS with just that 15%? Yes or no?
Thank you for the question. The solution, if they were not to utilize the TELUS Health technology that is underlying this highway that we talked about, they would have to find that from somewhere else in order to make the system work.
Si une province ou le Québec veut poursuivre le programme,
If a province or Quebec wants to continue this program, will they have to pay TELUS again a second time to use the program?
Thank you for the question. We would be in position to have discussions, and we are having discussions with several provinces at the moment to help in the transition and to keep the programs going. But it would be based on the requirements and the needs of each of the provinces.
22 seconds.
Monsieur Demirdash, avez-vous déjà eu...
Mr. El Demirdash, have you had agreements with, you've already had agreements with the government, and you own 85% of the intellectual property and the software we're talking about?
Seconds.
It's important to recognize as well that the speed to development of the solution was enabled by the fact that we had a lot of this technology already in place in advance, and that was helpful to getting the solution in place for Canadians faster.
Thank you very much. Now we'll go to Mr.